washing my hands here. Are you Katie?
Yes.
Pleasure to meet you. My name is Drew. I'm a nurse practitioner student who's going to be doing a head, eye, ear, nose, and throat exam, and also a mental health training afterward. Okay?
Okay.
Sound good?
Mm-hmm.
Okay. Pleasure to meet you. So we're going to go ahead and get started by starting with your head.
Okay.
I'm going to take a look at your hair. Looks wonderful, beautiful, healthy. Okay, your scalp is also appropriate color and looks pink, healthy, no dry skin or anything like that. Your head itself is normocephalic without lesions. Nothing abnormal that I can see. Let's see. The contour of your head is also smooth and it's appropriate for your body. Let's see. So I'm going to go ahead and just inspect the skin on your face and your head. Like I said, your scalp is pink and healthy. Skin looks very smooth, healthy, pink color, not dry, and no massive lesions or anything that I can see right now. So I'm going to have you just take a look at your face as well. Okay. And I can see that you don't have any involuntary muscle movements, and like I said, no masses or anything like that. I'm going to palpate your cervical lymph nodes, so I'm going to feel around your neck, up by your ears a little bit, and down. So I'm going to come behind you and take a feel. So just let me know if anything is tender or painful, okay?
Okay.
Feel okay?
Mm-hmm.
Okay, so your cervical lymph nodes are non-tender and absent of lymphadenopathy. So now I'm going to inspect your trachea. If you can lift your chin just a little bit. Okay, and I'm going to palpate here on your right side and your left side. Your trachea appears to be midline and no shift or no big issues right now. I'm going to take a listen to your trachea as well. You can just breathe normally, okay?
Okay.
I'm going to feel my stethoscope on your neck. Okay. Slight breath sounds are present over your trachea as we would expect. No stridor or anything like that. Let's see. And then finally, I'm going to move on to your thyroid gland. So I'm just going to feel on your neck again. I'm going to do some palpation and then I'll have you swallow in just a moment, okay?
Okay.
Okay. So, okay, you can swallow. All right. So I can barely palpate your thyroid isthmus. Your thyroid was smooth, an appropriate size, no goiter or mass or anything like that. And wasn't tender or anything?
No.
Wonderful. Okay, so we're gonna go ahead and move on to your mouth and your pharynx. So I'm gonna first take a look at your lips. They're pink, no cracking, no lesions or anything like that. Very, very healthy. Are you having any pain on your lips or?
Mm-mm.
Okay, wonderful. Let's see. So I'm gonna go ahead and palpate your, I'll feel your tongue, your hard palate, which is the roof of your mouth, soft palate, which is the floor of your mouth, and your oral mucosa are just the sides of your mouth, okay?
Okay.
So I'm gonna put on some gloves here. I'm going to use my otoscope here to just take a look inside your mouth and see that. Get a little bite here. So open up one. Wonderful. Okay, and I'm going to, while you have your mouth open like this, I'm going to just palpate the roof of your mouth, your hard palate. Okay. And you can lift your tongue up for me. Okay. palpate underneath. You having any tenderness or pain or anything like that? Wonderful. So and also I'll palpate your oral mucosa. I don't see any lesions. Your oral mucosa, hard palate, floor of your mouth, and your tongue as well are all soft pink and absent of lesions as well. So I'm going to take a look in the back of your throat at your tonsils, your pharynx,
Okay.
and do you have tonsils?
Yes, they're really tiny.
Okay, well, we'll take a look here. Go open your mouth again. Okay. Yes, they are. I can see them very small. So your pharynx, your tonsils, your pillars, and all that, and your uvula are pink, and they don't seem inflamed or have any lesions, no discharge, no swelling. You having any issues that you've noticed with the back of your throat or anything like that? Okay,
No.
wonderful. So let's see here. So I'm gonna go ahead and we're going to test your vagus nerve. Sorry.
Okay.
So what I'm going to do is elicit a little bit of a gag response or gag reflex. So I'm just going to touch back there and I'm going to watch the back of your throat.
Okay.
And open up. And wonderful. Okay, so the pillar's closed and your uvula rise at midline symmetrically. So your vagus nerve is intact. I'll throw this away. Get rid of my gloves. Perform hand hygiene. Okay. Thank you so much for all your help here. You're doing great. So I'm going to test your hypoglossal nerve. So all I need you to do is stick your tongue straight out. Perfect. Okay. So your hypoglossal nerve is intact because your tongue protruded straight out midline and didn't deviate with symmetrical. Okay. So we're going to move on to your eyes here. So we're going to go ahead and do a test called with the Snellen chart. So what I'm going to have you do is you stay right there. I'm going to hold the Snellen chart 10 feet in front of you.
Okay.
You go ahead and cover up your right eye.
Okay.
And read the smallest line that you can.
LEFODPCT.
Correct. Okay, now cover your left eye and uncover your right and do the same thing for me, okay?
LEFODPCT.
Correct. So you have 20/20 vision. Wonderful. All right. So, what we're going to do here is we're going to test your visual fields by confrontation. So what I'm going to have you do is look straight at me.
Mm-hmm.
Look straight at my chest here, and when I'm going to hold up a finger in the corners, and you tell me, without focusing directly on that finger, how many fingers I'm holding up. Okay? So look straight at me.
1, 2, 2, 1, 1, 1, 2, 2.
Wonderful. Okay. So all your visual fields are intact. I'm going to move on to your eyebrows and your eyelids and eyelashes. I'm going to put on some gloves here so we can host your face here. Are you doing all right?
Mm-hmm.
Wonderful. Okay, so I'm going to take a look at your eyebrows. They're symmetrical. The eyebrows have appropriate distribution of hair. They seem pretty healthy and not flaky or scaly or anything like that. Your eyelids are pink. Doesn't seem like there's any overt swelling or any lesions or anything like that. And your eyelashes, you have mascara on right now, but I can tell that they're pretty appropriately distributed and look pretty good. So I'm going to do a little bit of touching here and just let me know if anything's tender. Okay?
Mm-hmm.
Okay. So what I'm going to do is palpate your lacrimal apparatus, which is the kind of drainage system that your tears go through. So I'm going to start up here on your outer top of your eye, on the outer part. Any tenderness or pain or anything? Wonderful. We're going to move into here, right down the corner of your eyes. Okay. Any issues with that or any tenderness?
No.
Okay, so your lacrimal apparatus is free of lumps, swelling. Your eyes appear moist, so I believe it's functioning pretty well.
Okay.
So I'm going to take a look at your conjunctiva, so the pink part inside of your eye. So I'm just going to pull your eyelid down very gently. Take a look, let me know if I'm doing too much or if you have any pain. Okay, so I'm going to take a look at your tongue. Okay, your conjunctiva are pink. They're not. There's no evidence of erythema or swelling. Are they tender or painful at all?
No.
Wonderful, and they're moist. So, and your sclera also I can see is free of lesions, and they're nice and white. So I'm going to take a look in your eyes here. First at your pupils. Just look straight at me. Okay. Your pupils are equal round reactive to light. They there's no overt deficits. Each has a direct light response as well. So I'm going to take a look. What I'm going to have you do is look straight forward. I'm going to shine a light in the corner. In the side of your eye here. Okay. Now this other side. You're doing okay? Okay. So there is no crescent shadow, and I don't see any opacity, so that's wonderful. So now I'm going to have you follow the tip of my pen. We'll do that. It'll
Okay.
be easier. Just follow the tip of my pen. Go. Wonderful. So your extraocular muscle movements are intact and appropriate. So I'm going to go ahead and take a look at your lens of your eye and with the ophthalmoscope. So I'm going to take a look. I'm going to grab some more gloves here so I'll get close to your face. Your left eye. I'm going to look with my left eye with the ophthalmoscope. And okay, we're going to move to your right eye, my right eye. And go ahead and blink it as much as you need. Wonderful. Okay. So your optic disc has sharp margins. I don't see any evidence of edema or hemorrhage inside your eye. With the lens, your retina, the cup, or any of the retinal vessels or anything like that.
Okay.
Wonderful. So, I'm going to go ahead and move on to your nose. So, what we're going to do is put a cover on my otoscope here, and that'll help me take a look at your nasal canal. Go ahead and get some new gloves. So, what I'm happy to do is just kind of tilt your head back a little bit. Are you comfortable like that?
Mhm.
You okay?
Mhm.
All right. So I'm going to just take a look in your nasal canal. right side, you doing okay?
Mm-hmm.
Okay. So I can see that your nasal mucosa and are pink, moist, intact. They look very healthy. There's no evidence of any polyps or any lesions. Also, your nasal septum is grossly intact. It doesn't look like it's deviated or anything like that. I can see that your nose is symmetrical. There's no irritation around your nares or anywhere else, any rashes, no drainage. Like I said, your nasal mucosa is really pink and kind of pale pink and moist, looks very healthy. Let's see. All right, so we're gonna go ahead and move on to your sinuses. So I'm just gonna do some palpation here. Just let me know if there's any tenderness or anything. You having any issues there? Okay, no feelings of fullness, pressure, sensitivity, tenderness?
No.
Wonderful. Or congestion. Let's see. All right, so we're gonna go ahead and move on to your ears. So I'm going to take a look at your ear, the auricle, the whole ear, everything together. Looks intact. The skin's an appropriate color. I don't see any lesions or anything like that on the left ear. You do have some piercings, but they look intact. No issues. Same with your right ear. So I'm going to take a look inside your ear here. Otoscope again. Before I look in there, I'm going to go ahead and just palpate your tragus, your pinna, things like that, make sure. So, you have any issues on that left side? Okay, I'm going to do the same thing over here. So your right and left ear are both intact, no tenderness, no swelling. I don't see any lesions, skin tags, any ulcers or anything like that.
Okay.
So I'm going to go ahead and take a look inside your ear over here. So I'm going to do a little pull on your pinna here. Let me know if anything's uncomfortable. Okay.
Mm-hmm.
All right. Look over here on your right ear. Okay. So both of your ear canals are, pink, intact. I don't see any lesions or any major issues going on in there. There's a little bit of cerumen. There's no foreign bodies. Your tympanic membranes, both of them are pearly gray. Your left tympanic membrane has a cone of light at 7 o'clock, and your right your right tympanic membrane has a cone of light at 5 o'clock. So that is expected.
Okay.
Wonderful. So we're going to go ahead and move on to test your auditory acuity. So I'm going to have you cover your right ear, or you can push your tragus in, whatever works for you.
Okay.
So can you move your hair out of the way? Thank you. So when I'm going to say something with a whisper test, and you repeat back to me. So okay. So there's going to be
4K2.
Correct. And over here on your other side, do the same thing. Thank you.
Mm-hmm.
All right.
7B6.
Correct. So your auditory acuity is grossly intact. It's wonderful. Let's see what else we need to do here. So that concludes our head, eyes, ears, nose, and throat exam. So we're going to go ahead and move on to what we call a patient health questionnaire, or PHQ. This is, where is it? Here I have it. Perfect. So this is going to assess your mental health and assess for any depression or anything like that.
Okay.
Okay? You feel okay doing that?
Mhm.
Okay.
All right.
So you go ahead and fill that out, and then I'll go over it with you afterward.
Okay. There you go.
No, finished? Okay.
Yeah.
Thank you. Okay, Katie. So, looks like, let me score this really quick, or add it up, not score. So your total score was a 2, so that would score you at minimal or no depression.
Mhm.
The proposed, the proposed course of action recommended would be no intervention at this time.
Okay.
Well, thank you so much. That concludes all of our exams. Do you have any questions, or do you? Okay.
I don't
Thank you
think
so
so.
much.
Mhm.
All right, I appreciate it, and it's a pleasure to meet you. Take care.
Thanks.